to our channel, Alena Media TV. We are broadcasting from Toronto, Canada. My name is Elsa Abraham. We have some good news, and the good news is Alena Media TV would like to announce to our lovely viewers that we are expanding our program, so kindly take note of our weekly activities. On Mondays, we'll report on COVID-19 and editorials. Tuesdays are African history. Wednesdays, world news and editorials. Thursdays, COVID-19 reports and African news. Friday is world history. Saturday is African news and editorials. Another good news is we are expanding our satellite broadcast very soon. This satellite broadcast will begin on the 20th of June 2020, which will also be Eritrean Martyrs Memorial Day. Kindly take note of our frequency. Nile Sat Vertical 12728. Symbol rate 27500. FEC 5/6. We'll bring you more details after this short break. Kindly stay with us. Welcome back from that short commercial break. Now our headlines. Coronavirus pandemic situational update in Ethiopia, Eritrea, Sudan, Djibouti and Somalia. African countries moved from COVID-19 readiness to response as many more confirmed cases. Now the news in details. The global community is racing to slow down and eventually halt the spread of COVID-19, a pandemic that has claimed thousands of lives and sickened tens of thousands of others. In Africa, the virus has spread to dozens of countries within weeks. Governments and health authorities across the continent are striving to limit widespread infections. Since the start of the outbreak, the World Health Organization has been supporting African governments with early detection by providing thousands of COVID-19 testing kits to countries, training dozens of health workers, and strengthening surveillance in communities. 44 countries in the World Health Organization African region can now test for COVID-19. At least the start of the outbreak, only 2 could do so. WHO has issued guidance to countries, which is regularly updated to take into account the evolving situation. The guidelines include measures as quarantine, repatriations, and citizens and preparedness at workplaces. The organization is also working with a network of experts to coordinate regional surveillance efforts, epidemiology, modeling, diagnostics, clinical care and treatment, and other ways to identify, manage and disease and limit widespread transmissions. World Health Organization is providing remote support to affected countries in the use of electronic data tools so national health authorities can better understand the outbreak in their countries. Preparedness and response to previous epidemics is providing a firm foundation for many African countries to tackle the spread of COVID-19. Importantly, basic preventive measures by individuals and communities remain the most powerful tool to prevent the spread of COVID-19. World Health Organization is helping local authorities craft radio messaging and TV spots to inform the public about the risk of COVID-19 and what measures should be taken. The organization is also helping to counter disinformation and is guiding countries in setting up call centers to ensure the public is informed. Moving on to our next story for the day, coronavirus pandemic situational update in Ethiopia, Eritrea, notification not on COVID-19. The total laboratory tests conducted within 24 hours are 2,836. Of these, 109 of them are confirmed positive for COVID-19, and total confirmed cases as of today are 1,172. Among the confirmed cases, 61 of them are male and 48 are female, and their age ranges from 5 to 70 years. All of the confirmed cases are Ethiopians. Among the cases, 99 of them are identified from Addis Ababa, 2 from Tigray region, 5 from Oromia region, and 3 from Harare region. The potential sources of exposure of the confirmed cases are presented below. Travel history from abroad are 2 cases. Known contact with confirmed cases are 13. Cases with known contact with confirmed cases and no travel history are 94, totaling a number of 109. 3 Ethiopians have passed away and the laboratory test turned positive for COVID-19. Deaths are a 29-year-old female from Setit Humera, Tigray region, a 75-year-old female from Addis Ababa, and 55-year-old male from Kaffa zone, who recently moved to Addis Ababa. The first 2 were receiving care in a health facility, while the third one was a dead body taken to health facility for forensic investigation, and sample was tested positive for COVID-19. This brings the total death related to COVID-19 in Ethiopian country to 11. Ministry of Health and the Ethiopian Public Health Institution would like to pass its condolences to the families. Furthermore, 1 person from Tigray region recovered from the disease, bringing the total number of recoveries to 209. Total laboratory tests conducted 109,451. Laboratory tests conducted within 24 hours ended cases of 2,836. Number of confirmed cases within 24 hours aids to 109. Total patients of COVID-19 in the treatment centers are 950. Patients in intensive care are 4. Newly recovered is only 1. Total recovered cases are 209. Total deaths ups to 11 and returned to their country are 2. Total confirmed cases of the day are 1,172. The laboratory samples were collected from the high-risk community members, returnees, passengers at mandatory quarantine centers, contacts of the confirmed cases, health facility visitors, and suspects at isolation centers. In Eritrea, confirmed cases were 39 and recovered cases 39 with 0 deaths. We at Alena Media TV would like to say a very big congratulations to all Eritreans for combating this deadly virus strategically. We hereby encourage all the Eritrean people to take all the preventive measures seriously, as all neighboring countries, Ethiopia, Djibouti, Somalia, Kenya, and Sudan, cases are still increasing in their cases every second. And in Sudan, confirmed cases are 5,026 plus 279, with a number of 1,423 recovered and death tolls rising from 286 plus 29 in the next seconds. In Djibouti, coronavirus cases are 3,354. Death toll also 24, and recovered cases are 1,504. Somalia also have coronavirus cases of 1,976 deaths, 78 recovered. 78 deaths and recovered cases are 348. Considering the increase in transmission of COVID-19, the Ministry of Health and Ethiopian Public Health Institute would like to let the public go strictly ahead to all precaution measures. We need to be reminded that every single action we take determines the risk of contracting the virus. Therefore, we should maintain physical distancing, wash your hands with soap and running water frequently. Stay at home and avoid mass gatherings. Cover your mouth and nose with face mask or cloth mask wherever you are going. This is where we end today's episode on COVID-19 update. Please like, share, comment. Let us know your thoughts for today's episode. Thanks for watching.